1. Which of the following is an essential component of effective adult learning in ophthalmic technician training? A. Passive learning. B. Active engagement with hands-on practice. C. Repetition without feedback. D. Memorization without understanding. 2. What is the most appropriate evaluation method to assess the competency of an ophthalmic technician? A. Written exams only. B. Oral interviews. C. Practical hands-on demonstrations. D. Self-assessment. 3. Which of the following is an example of a curriculum development strategy for ophthalmic technician training? A. Teaching only theoretical concepts. B. Implementing real-world case studies. C. Focusing exclusively on textbooks. D. Relying solely on online tutorials. 4. Which of these communication skills is vital when working with patients in an ophthalmic setting? A. Speaking in technical jargon. B. Active listening and clear simple language. C. Ignoring patient concerns to save time. D. Using complex medical terminology. 5. What regulatory requirement is critical for an ophthalmic technician when handling patient information? A. Ignoring patient privacy laws for efficiency. B. Compliance with HIPAA and confidentiality standards. C. Discarding patient records without documentation. D. Sharing patient information without consent. 6. In ophthalmic technician training, which mentoring technique is most effective? A. Providing minimal feedback. B. Encouraging independence while offering support. C. Focusing solely on theoretical knowledge. D. Micromanaging every aspect of learning. 7. What is the primary goal of assessment in an ophthalmic technician's training? A. To make students memorize procedures. B. To ensure students can demonstrate safe and accurate skills. C. To test their knowledge on theory alone. D. To discourage students from making mistakes. 8. Which of the following is an example of a formative assessment in ophthalmic technician training? A. A written final exam. B. An ongoing performance review during clinical practice. C. A certificate at the end of the course. D. A multiple-choice quiz at the start of the course. 9. How should an ophthalmic technician demonstrate proficiency in visual acuity testing? A. By correctly interpreting patient complaints. B. By correctly performing a Snellen chart test and recording results. C. By analyzing theoretical knowledge in written exams. D. By relying on outdated testing methods. 10. What is the role of feedback in the learning process for ophthalmic technicians? A. To criticize students for mistakes. B. To provide constructive insights for improvement. C. To avoid addressing errors. D. To only reward correct answers without explanation. 11. Which regulatory agency standards must ophthalmic technicians comply with regarding patient care and safety? A. American Medical Association AMA. B. Food and Drug Administration FDA. C. Occupational Safety and Health Administration OSHA. D. National Fire Protection Association NFPA. 12. Which mentoring method is most effective for adult learners in an ophthalmic technician program? A. Lecture-based teaching with minimal interaction. B. Hands-on training combined with feedback and discussion. C. Relying solely on textbooks for guidance. D. Allowing students to work independently without supervision. 13. What is the best method to assess an ophthalmic technician's communication skills with patients? A. Direct observation during patient interactions. B. Written communication only. C. Peer review of patient interaction. D. Self-assessment surveys. 14. Which type of assessment is used to evaluate the ophthalmic technician's ability to perform specific procedures? A. Summative assessment. B. Practical skills assessment. C. Written quiz. D. Verbal feedback. 15. What is the primary responsibility of an ophthalmic technician regarding patient care? A. To diagnose medical conditions. B. To educate patients on surgery options. C. To accurately perform diagnostic tests and assist in treatments. D. To provide primary care and prescribe medication. 16. What aspect of ophthalmic technician training is most likely to benefit from simulation-based learning? A. Customer service techniques. B. Clinical skills like visual field testing. C. Reading patient records. D. Writing patient notes. 17. When designing a curriculum for ophthalmic technician training, which is an important factor to consider? A. Ensuring the course content is overly simplistic. B. Structuring the course to include both theoretical and practical components. C. Focusing only on patient interaction. D. Ignoring patient confidentiality requirements. 18. Which communication technique is most effective when explaining a diagnostic test result to a patient? A. Using only medical terminology. B. Simplifying the language to ensure patient understanding. C. Providing written instructions only. D. Avoiding patient interaction and delegating to others. 19. What should an ophthalmic technician do if they encounter an unfamiliar test result? A. Ignore the result and move on. B. Consult with a supervisor or medical professional for guidance. C. Guess what the result means. D. Immediately share the result with the patient without confirmation. 20. What is the purpose of implementing continuing education for ophthalmic technicians? A. To reduce the technician's responsibility in patient care. B. To ensure the technician is updated with the latest procedures and technologies. C. To provide entertainment during training sessions. D. To encourage technicians to repeat the same training every year. 21. How should an ophthalmic technician handle a patient who is anxious about undergoing a test? A. Ignore the patient's concerns and proceed with the test. B. Acknowledge the patient's anxiety and provide reassurance while explaining the procedure. C. Rush the procedure to avoid patient delays. D. Ask another technician to handle the patient. 22. Which of the following best describes effective curriculum development for adult learners in ophthalmic technician programs? A. Providing rigid one-size-fits-all lessons. B. Offering diverse learning methods and feedback opportunities. C. Limiting content to only written materials. D. Focusing on theoretical content without practical application. 23. Which communication technique is most effective when explaining the importance of preoperative instructions to a patient? A. Giving a lengthy explanation with technical details. B. Using visual aids to support verbal communication. C. Providing written instructions only and assuming understanding. D. Speaking in a monotone voice without engaging the patient. 24. How can an ophthalmic technician demonstrate effective leadership during patient care? A. By delegating all patient interaction to other staff members. B. By taking charge of the situation and ensuring proper procedures are followed. C. By avoiding direct communication with patients. D. By deferring all decisions to the medical team. 25. What should an ophthalmic technician do in the case of a medical emergency during a test? A. Continue the procedure without any changes. B. Alert the supervising physician and follow emergency protocols. C. Ignore the emergency and focus on completing the test. D. Handle the emergency on their own without involving others. 26. How can adult learning principles be applied to training in ophthalmic technician programs? A. By focusing on passive learning methods. B. By incorporating real-life scenarios and hands-on practice. C. By avoiding any form of evaluation or feedback. D. By limiting the course to theoretical knowledge only. 27. What is the most effective way for an ophthalmic technician to keep up with advancements in their field? A. Relying solely on experience. B. Participating in continuing education and professional development opportunities. C. Focusing only on basic skills. D. Ignoring new technologies and techniques. 28. Which of the following is a key consideration when designing an ophthalmic technician's performance evaluation? A. Focusing only on technical skills. B. Providing regular feedback and incorporating self-assessment. C. Using only a final written exam to assess performance. D. Avoiding feedback to maintain student confidence. 29. How can an ophthalmic technician best ensure patient comfort during an eye exam? A. By rushing through the exam to save time. B. By explaining each step of the process and ensuring the patient is at ease. C. By using only technical terms with the patient. D. By conducting the exam without considering the patient's concerns. 30. What should an ophthalmic technician do if they are unsure about a procedure during patient care? A. Proceed with the procedure without asking for help. B. Consult with a supervisor or more experienced technician. C. Ignore the uncertainty and proceed with the patient. D. Let the patient complete the procedure themselves. 31. Which assessment method is most suitable for testing the clinical competency of ophthalmic technicians? A. Written multiple choice exams. B. Practical skills evaluations in a clinical setting. C. Oral examinations. D. Self-reported surveys from the technicians. 32. What is an essential characteristic of an ophthalmic technician's professional behavior? A. Focusing only on technical skills. B. Demonstrating strong interpersonal skills and empathy. C. Ignoring patient concerns to complete procedures quickly. D. Keeping patient information confidential only when convenient. 33. Which technique should an ophthalmic technician use to improve their communication with patients who have limited English proficiency? A. Speak louder to ensure they understand. B. Use simple, clear language and provide visual aids. C. Assume the patient understands without clarification. D. Avoid engaging with the patient directly. 34. How should feedback be delivered to an ophthalmic technician during training? A. Only at the end of the training session. B. In a supportive, constructive manner that encourages improvement. C. In a negative, critical tone to discourage mistakes. D. Without any guidance on how to improve.